November is National Bladder Health Awareness Month. 1 in 3 women experience bladder issues, which sometimes get in the way of doing the things you love. But what can be done about it? With that, let's welcome OBGYN Dr. Jessica Shepard and the founder of Women's Health Foundation, Missy Lavender. Good morning.
Good morning. How are you?
We're good. And I was surprised in preparing for this visit to hear 1 in 3. So why are bladder issues so common?
So bladder issues are so common in women because the pelvis holds a lot of organs. It has the uterus, it has the bladder, and also the colon. And so when you have all these things in close proximity and you encounter events such as high stress impact sports such as horseback riding, when you have childbirth, labor, and also menopause, when you have a decrease in estrogen, which really helps support the muscles and the tissues in the pelvis, you really start to see deterioration of the pelvic muscles. And when we talk about stress urinary incontinence, specifically the bladder, and so you're going to have that leakage of urine.
With women, and don't we all want to continue to live life? I mean, you don't want to be sidelined by something, but issues affect the day-to-day. So how can you go on despite those problems?
Well, I think the first and most important thing for women to understand is that they're not the only ones, Mary, with these conditions, that these are very common. 35 million women, 1 in 3, whatever statistic you use, it's pretty horrifying. And so to know you're not alone, to understand that this is something that you need to talk to your healthcare provider, your doctor about, and that to know that there's a full range of options for you to get better.
Yeah, I think that's important too, to feel like, well, I've got this, it's no big deal, I'll just tough it out. There's nothing that can be done about it. Dr. Shepard, what are some of the options? And I know it varies from patient to patient, but just a few of the more common treatments. What do you say?
Yeah, when we talk about stress urinary incontinence, it really can range anywhere from mild to very severe. And all of those, whether it's mild or severe, should be discussed with your physician, because there are such a plethora of options for women to look at when they talk about stress urinary incontinence. So we have pelvic physical therapy, which is to help strengthen the muscles and kind of locate and isolate some of the muscles in the pelvis that really can work towards bettering stress urinary incontinence. Also, we have very few medications that we can prescribe for some women who have stress urinary incontinence. And launched in September, Poise has impressive bladder supports, which are used to help. It's the first internal device that you can use. It's similar to a tampon, which you insert and helps prevent the leakage of urine. And then we also have surgery. Surgical options are some of the ways that we treat stress urinary incontinence and help women.
We have less than a minute. A lot of women are going to be uncomfortable talking to their doctors, getting this conversation started. Is there an easy way to do it?
Well, if you aren't comfortable for some reason having this conversation yet, we would urge you to think about going online. You can come to the womenshealthfoundation.org site. Impressa has a wonderful site, impressa.com, and where you can learn more about the stress urinary incontinence itself, but also this wonderful new groundbreaking device.
We like putting stuff like this out into the universe, so that you were just talking a little bit ago on the show about men and health issues, and now for women to, if we're talking about it on the air, hopefully at home they feel more comfortable sort of being empowered to take control of their health. Dr. Shepard and Missy, thank you.
Thank you.
Thank you so much.
We appreciate it.